The UK has experienced its most deadly day in the pandemic. Even though rising numbers have been expected, it doesn't make it any less devastating. And new statistics released by the ONS show the virus is much more widespread than previously thought, with around 1 in 10 people estimated to have been infected by December. Broken down, that shows 1 in 8 people in England had antibodies. In Wales, that was 1 in 10. 1 in 11 people in Scotland, and Northern Ireland had 1 in 13. The glimmer of hope many have been focusing on is the vaccine rollout. The race to get the most vulnerable a jab more pressing than ever. Over 4.2 million people have now received their first dose, with just over 200,000 given theirs on Monday. That's below the 300,000 mark that was achieved on the weekend. Only 6 in 10 care home residents in England have been vaccinated, raising new concerns by the sector that the target of everyone being done by Sunday may not be possible. And further concern, some staff are refusing vaccinations.
Well, I think it is a challenge, but of course, they're well within their rights not to, and we have to try and convince them to do so.
Would you like your relative or your mother to be cared for by someone who hasn't had a vaccine?
Ideally, in an ideal world, I would like my family to be cared for like every other family would like to be cared for by somebody who's not going to transmit. But if we can then get the residents vaccinated, which is the other bit of this equation, then we're protecting the residents anyway.
Here in this care home, while their priority is older residents, they say other vulnerable people living in a residential setting should also be a primary issue.
Now we want to see more people in other services being vaccinated, and that includes people who have mental or learning disabilities or autism. And with this, it's very time critical. We're finding a difference in terms of positive cases this week to what we had last week to what we had the week before.
And its COVID cases still being relatively high, over 33,000 reported earlier, that mean restrictions will be here for a while. In Scotland, that was confirmed today.
That means that the lockdown restrictions, including the strict stay-at-home requirement, will remain in place across mainland Scotland and some island communities until at least the middle of February.
But it's vaccination rollout where the focus continues to fall, and the question of who should be next. That row rumbling on today. We've just had the National Education Union who've been talking and saying that teachers should be in the priority list. You've got that priority list of 9 teachers, they say should be 10. But it's not as simple as that. Met Police Commissioner Cressida Dick has talked about police officers needing to be for the front of that queue. But then what about supermarket workers? And these are all questions that the government are going to have to answer. And one more development, we're seeing reports that ministers are set to stop plans to have daily COVID tests in schools. And that could be a huge blow, not just for parents, for teachers, for schools, and that aim of having schools getting back to normal as soon as possible, seeming a little bit further.
Aisha Tal reporting. Well, now I'm joined by Professor Christina Pagel, a health research mathematician and member of the independent SAGE group. Professor Pagel, do the statistics tell us that although these terrible figures occurred today, we may be at the peak?
The sound. Sorry.
Oh, are you having a difficulty hearing me? Let me try again. Do you sense, Professor Pagel, can you hear me?
Yeah, I can hear you now. Sorry. Yeah.
Professor Pagel, I do apologise. Do you sense that the statistics are telling us that we may be somewhere near the peak of this terrible pandemic?
Yeah, it does look that way. Cases are coming down now about 20% a week, which is really welcome. Hospital admissions take longer because it takes a bit longer from infection to you needing hospital. So it looks like London, the southeast and the east are now going down quite steadily, but slower than cases. So unfortunately, we're still seeing quite high admissions there, and in other regions they're still going up. But I think we are at kind of the peak occupancy now. But we are almost double the number of patients in hospital now than we had in wave 1. So we've got a really long way to go to get back down. Well,
that's interesting because the vaccination total today is the worst week yet, very low. What does that tell you? A shortage of vaccine or simply an inability to get it out?
I'm not sure. It looks like we've probably vaccinated a high proportion of people over 75. So it could be just something administrative and trying to target the next group, which is the 70 to 75-year-olds. It could be a supply issue. I mean, I don't know, but it's still over 200,000 people. We did vaccinate almost 2 million people over the last week. So that is good news.
People are saying that the lockdown may actually be working, but at the same time, other people are saying, I'm afraid it may have to go on beyond February. What do you sense from the statistics?
Yeah, I think it has to go on well beyond February. And for two main reasons. The first is that even if we vaccinate everybody over 70, 92% of cases are in under 70-year-olds. It's not going to stop transmission. And if we then let COVID pick up again among anyone under 70, then firstly, you've got long COVID to worry about, which is up to 10% of people, but also you're giving the virus a lot of opportunities to mutate and to mutate in ways that might make the vaccine ineffective, which we absolutely do not want. And the other reason, which is like really important, is, we owe it to the NHS. In wave one, we spent 40 days with more than 10,000 people in hospital. And in the summer, the British Medical Association did a survey that showed about half of ITU frontline staff had PTSD, so post-traumatic stress syndrome. 1 in 5 nurses had thoughts of suicide. And we've now had, in the second wave, it's been 80 days since we've had 10,000 people in hospitals, and we haven't peaked yet. We've probably got another 8 weeks before we even get back down to 10,000 people in hospital, which is still a huge number. So, NHS staff, we owe it to them. They're working beyond their limit. They're being traumatized. They're suffering more stress than frontline soldiers right now. We owe it to them not to increase their burden. And that means getting cases down, and it means getting hospitalizations back down really to September levels, which was 2,000 people in hospital.